Hi all, this is Archana from Therapy Services for You. I'm an occupational therapist with over 15 years of experience in OT, and I've been working in the field of neurology and pediatrics. So today I want to talk to you about emotional regulation. What is emotional regulation? It's the ability of a child to regulate their sympathetic and their parasympathetic nervous system, and to acknowledge and know and label what their emotions are, and to respond in the manner emotionally that's appropriate for the situation. A lot of the times, parents of neurotypical and neuroatypical children come to me and tell me that my child has anger issues. They will kick, scream, bite, have full-blown meltdown. They can't manage their anger in several situations. The normal response to this is trying to manage this using behavior management strategies. But this wouldn't be an ideal response when this is triggered by things like sensory overload, or there are other reasons why the child is having an emotional dysregulation issue. So let me explain this with the model of the brain. So this is my model of the brain. It's an adaptive model by Dan Siegel. So if you can imagine this to be the brain and the eyes in the front. So I'm just flipping the brain this way. And this would be your brain stem. This would be your spinal cord carrying messages up to the brain stem. And this is the part which controls your heart and your respiratory rate. Now, this would be the part which controls your emotions, and that also controls the fight, flight, and fright response. And this would be the smart part of the brain, or the bit that's just behind here, called the prefrontal cortex. Now, this is the part that's responsible for thinking, reasoning, making logical decisions, waiting for things, and also empathizing with others' feelings, knowing your emotions and recognizing others' emotions and having compassion. So what now happens is, let's imagine that there is a snake that comes your way. What this part would do is automatically go into a fight, flight, and fright response, which is good in a way, because then your body would get ready to escape the snake and run away from the snake, which is danger. So this part of the brain gets flipped. What I mean by that is the lid is flipped and the logical and thinking part of the brain gets cut off. It doesn't function. So you don't have to stand there and calibrate, oh, is this a poisonous snake? Or is it going to come and bite me? How long is it going to take for the snake to come and bite me? But imagine this is a false alarm scenario, and this is only a rubber snake which is lying there. So I see it and perceive it to be a snake, and then this part of the brain would send false alarms. Oh, fight the snake, take a stone, run away, get ready to, attack it if it attacks you. And it comes up with endless scenarios, and sometimes you run, sometimes some people freeze and stand, or some people start fighting it. So that's the fight, flight, and fright response. Now, what we essentially want to teach children is how to activate this prefrontal cortex of the brain, the smart part of the brain, and to teach children how to calm down in scenarios like this. Because there are several scenarios when children get false alarms. For example, if a child has sensory processing disorder and doesn't know where they are in space because they have a vestibular problem, or they cannot feel their joints, so they don't know if they're upright or if they're lying down, they don't get the feedback from their bum joint to their body to say they're sitting, or they could be feeling like they've been thrown out in space because of vestibular issues. Or some children might have auditory sensitivities, so they could pick up and hear frequencies that you and I don't hear, or they could be defensive to certain frequencies, they don't like certain sounds, or their brain may not know which sound to filter out and which sound to pay attention to. So if the teacher is speaking in a classroom, their brains could be paying equal attention to the bird sound to a child, hitting their pencil on the desk, and to the teacher's voice. And imagine all of this together. The child's, this part of the brain, the limbic system, would start sending messages of panic, 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 anxiety mode. And then the smart brain would be hanging on. At one point, the lid will flip. So the child's ability to reason and to logically think in that scenario will be cut off. So what will then happen is this child will get into a fright, flight or fight mode. And this could be a classroom scenario, it could be a birthday party, it could be a calm scenario, like it could be an extracurricular recreation class where everybody is nicely seated and paying attention to the teacher. But this particular child is going into fright, flight or fight mode. So he immediately goes into the ground and has a meltdown, starts crying, screaming, dashes out of the room, or maybe nails and claws at the teachers, doesn't know what to do, or some children just freeze and they won't talk anything. You just see a response of absolute freeze in them, and some of them will just shut out completely. So how do we teach these children to emotionally regulate? Essentially, how do we teach them to balance between the sympathetic and the parasympathetic nervous system? So the sympathetic nervous system is what causes this revving up of the fight, flight and fright mode, and the parasympathetic nervous system is what helps you calm down. Essentially, the sympathetic nervous system makes my heart beat faster, my lungs breathe quickly, and my intestines might churn up, whereas the parasympathetic nervous system will help us calm down and relax. So the first tip is to teach your children to breathe properly. So what I mean by that is to take good inhalations for the count of 4. What I mean by the count of 4 is you could count for the child saying 1, 2, 3, 4. And the child has to inhale to the count of 4. And exhale through their mouth to the count of 5. Inhale to the count of 4. Exhale to the count of 5. Okay, so this is tip number 1. The next thing is you might have children who are very young, who don't understand your words, or there are children who are non-verbal, or children who don't speak. So for those children, there are techniques that you could use which involve things like this. This is a TheraBand. You could get it at your sports store. So a meter of this would cost you a few hundred rupees. And what you can do is give the band to the child's hands and ask them to stretch it out like that. So when they stretch it out like that, the joint receptors, proprioception receptors, would send messages from the body to this part of the brain, and then to this part of the brain saying calm down, calm down. So the child would then learn how to calm down. The next thing they could do is get a ball like this, a squeezy ball. It's a rubber ball, it's called a stress ball. And the child can hold it in their, you could pack it in their bags to wherever they go, or they could have a little backpack to carry in their car if they have a meltdown or when they go shopping. And they could just take it out and give it 10 good squeezes. And if it's a child that's too young, you could get a ball that fits their hand, or you could get them some nice therapy as well, which gives good resistance to the joints. So if you found this video helpful, give us a like and a subscribe down below, and let us know what topics you would like us to cover in the next video. Good luck and see you soon. Bye bye.